Welcome to The Pulse, brought to you by Helen Fairview Centers. I'm Henry Florsheim, President and CEO of the Wichita Falls Chamber of Commerce. We are streaming live on Facebook and YouTube and will be rebroadcast on KJTL Texoma's Fox 18 on Sunday. My guest today is the CEO of United Regional Healthcare System, Phyllis Cowling. Phyllis, thanks for joining me today. What's the last 6 weeks been like for you?
The last 6 weeks, you mean the last 6 weeks, it feels like 2 years?
Yes.
That would probably sum it up probably as well as anything.
We're still in March, right?
It's what?
We're still in March, right?
We're still in March. I saw a meme that talked about 2020 being a leap year. It was a very unique leap year. We had 29 days in February. We had 3 months in March and 2 years in April. And that pretty well sums it up. Really, the last 2 months have been in some ways a blur for us here. I think it was really literally 2 months ago, maybe today or yesterday, when the county experienced its first COVID patient, or COVID case, I should say. And from that point on, we were running pretty hard just to make sure that we were ready. And in fairness, we didn't start 2 months ago. We started several weeks before that in preparation, but lots of decisions, lots of movement coming in from different external agencies, whether it's the city and county, the state, the federal government, the CDC. So just coordinating all of that has been unique.
This morning, you told me about a SWOT analysis you and your team did regarding the last couple of months. What did you learn?
Well, first of all, it's always very refreshing and very positive when the list of your strengths is a whole lot longer than the list of your weaknesses that you've identified. And that was very much the case here. We identified, and I won't say we identified it as a part of the SWOT analysis. We knew it already, but we confirmed it that our team was ready. And I think that's a testament to our disaster preparedness crew, our infection prevention team, our materials management team who had put in the supply of our PPE. So we had been planning for this, and that was absolutely a strength as this unfolded. And probably one of the biggest strengths was just the way our team, and I say our team, I don't mean me, I don't mean even our senior team, but throughout our organization, everybody just stepped up, did what needed to happen, regardless of what their quote unquote job description might say. That was an incredible strength all throughout this.
So I'm going to put you on the spot. Talking about the team, who on the team, and this can be on your hospital team or someone else in the community, who has really stepped up and gone above and beyond?
Oh, wow, Henry, there's too many people really to even mention. Again, I would say internally, I'm going to leave people out, but I will tell you that April Little, who is our infection prevention manager, certainly has been above and beyond throughout this. And her coordination with the health department, and another hero I would call is Lou Kreidler, Amy Fagan, and their whole team over at the health department. So I think we've been very blessed with some heroes internally, a lot of heroes internally, and we've had a lot of blessings throughout the community. First Baptist Church, as an example, helped us stand up childcare. When all of the childcare was forced to shut down in the community, we had to have our employees here, our nurses, our support team. So we scrambled to figure out how are we going to make childcare available, and First Baptist Church stood up. Just incredible numbers of people throughout the community, restaurants who brought food for our emergency department team, people who were sewing masks for us. It was an incredible outpouring of support for the healthcare system. And again, a lot of folks internally rose to the occasion as well.
Say you could go back 2 months or more knowing that this was coming. Is there anything that you guys would do differently?
Oh, no question. There's some things we could do better. As an example, this morning, when we went through our SWOT analysis, we talked about the communication. And we knew going into it that communication, it doesn't matter how much you do, you can always do better. And so identified some opportunities on how to communicate more proactively. I think another thing that we were dealing with is we were getting various directives and changes that were coming very, very quickly from the CDC, from the state, from other agencies, and how we were having to react very quickly to those and make changes operationally. And we didn't always have the luxury, or at least we didn't take the luxury of communicating all the why behind what we were doing. So I think sometimes our staff thought we just couldn't make up our own minds, when really what we were doing was we were responding to a lot of folks outside the organization. But again, strengths outweigh weaknesses. So we'll learn from this, and I'd love to say we'll do better next time. I hope we don't have a next time, at least not to this rate. But we also know that we're going to have waves of this. I get a little bit sensitive when people say post-COVID. I said, we're not post-COVID. We may be post the first wave of COVID, but we expect that we'll have additional waves, and we want to stay prepared.
Well, I know what you mean about the communication, because other than the attempts just to keep people safe, all the information coming down from the locals and the states and the federal government, it was tough for us too, because one of the responsibilities we took on was just trying to make sure the business community knew what was happening and what the rules were. And they were changing so fast. I mean, even just, last week, the school district announced that they were going to have graduation. They had met behind the scenes for 3 weeks to make a plan. And you might have been involved in some of those discussions. And not an hour after they released their plan, Governor Abbott comes up and says, hey, guess what? Everybody can have graduations, but not until June 1st. And so the district here had to change all their plans. And that's just the way it's been since day one.
Absolutely. And I give a shout out also to folks at the school district, to the city, to the county, to you and the chamber. One of the things that I very much appreciated is the conversations that we were all having. We were all engaged in that. So it wasn't as if people were making decisions unilaterally or remotely without talking with other affected parties. And I think that's one of the real strengths of our community, is that ability to engage with each other every day. But certainly it was critical in this crisis.
Absolutely. Talk to me about your routine. How has it changed over the last couple of months?
I'm not sure my routine has changed a whole lot. I laughed. I said, those of us that are introverts by nature, we were born for this crisis. So my routine has been really come to work, go home, and that's not unusual. I think just maybe a little less getting out on the weekends personally. But as far as a work routine, I've not worked remotely. We have people that have. Probably about 10% of our employees we moved them to a remote work from home pretty quickly. What has changed significantly is probably starting mid-March to end of April, we were all COVID all the time. As you know, I have always have goals and always have strategies that we're working on organizationally. All of that had to get set aside so that we could do what we needed to do to ensure safety and responsiveness for our employees, our medical staff, and most certainly for our patients in our community. So the last 6 weeks, really, we've come back out of that a little bit, but I would say from mid-March to end of April, we were pretty well off COVID all the time.
You brought up working remotely, and the chamber staff has been working from home for 2 months now, and we're excited to come back on Tuesday after Memorial Day and reopen the office. What do you see for the future of United Regional in terms of remote work? Because a lot of this is going to stick around for a long time.
Yeah, I think for the folks that have been working remotely, a lot of those will continue to work remotely. I think we've learned that there's some advantages to it. Now, on the flip side, as I'm sure you know, and multiply that by the number of staff that we have, the more people you have working remotely, the more we have to work to engage those individuals in the culture of our organization. And I will say that's something that we're very, very proud of, is the culture of excellence that we have here within United Regional. And just the way people interact, the way we engage with each other. So how are we going to maintain those really positive elements when we have people working remotely? And I think it's doable. I mean, you look at organizations around the world who do it all the time, but it's different. And I think we'll have to adapt to a world that is different. I don't think that's all bad. I think I've told somebody several times, I said, COVID's one of those things that's handed us lemons. Make some lemonade. We're gonna learn some things out of this that actually will benefit us going forward. And working from home may be one of those.
No doubt. And we found out one of the things that you got to think about is just the tools that you're going to use, because we basically started from scratch in terms of remote working technology. We didn't have a software platform ready to use. Half of us didn't either have webcams set up at home or know how to use them. And so now, I'm not going to say we're pros, but now the team has talked about it. And I think we're going to have opportunities where some of the staff can work from home a little more often, not all the time, but if there's a need to do it, we figured out how it works. And then having meetings around the community, if you and I need to meet and you don't have to drive over here, I don't have to drive over there, but we can see each other, that helps with that engagement so much.
Absolutely. And we've done the same thing. You and I were talking about just the getting comfortable with virtual meetings as an example. And I remember my first virtual leadership team meeting, which is with our directors, our department directors across the organization, about 40, 45, 50 people. And let's just say that first meeting was very awkward. I felt very uncomfortable, but I will also say that I'm pretty well known for saying success doesn't happen when you're comfortable. I mean, change, we have to continue to change, and to change, we have to be discomforted a little bit. So I said, I have to practice what I preach. I was uncomfortable, but we got through it. And since then, I'm not going to say I'm a pro at virtual meetings by any stretch of the imagination, but I'm better than I was, even 4 or 5 weeks ago.
No doubt. If you would have told me 3 months ago I'd have this show where we did this every week and got together and talked about current events and things going on in town, and I would have said, you're crazy. I don't want to do it. I don't like it. I'm not comfortable doing it. But like you said, just the comfort level comes. Just try it.
I'm pretty sure I said all of those things before my first virtual meeting. The other place I'll tell you that we've identified real opportunity from this type of technology is in telemedicine and telehealth. Think about what we were going through trying to socially distance people, and people were nervous about coming into, even for their clinic visit, a scheduled appointment. We were trying to manage the COVID risk. And so we turned to telemedicine. And I saw numbers yesterday. We saw something in March and April, something like an 1,800% increase in telemedicine. And I think I told you that I shared with our board that for 2 years, we beat our organizational head against the wall, trying to get our physicians, our patients, ourselves to adopt and adapt to this technology. And I laugh when I say, well, all it took was one good pandemic. And all of a sudden, we're doing telemedicine pretty routinely now.
Yeah, very simple. And I've used it before. You call in and you get I don't remember if it's a doctor or a nurse, but in a few minutes, you get a prescription and pay a small fee, and the prescription gets called in, and it's awesome. And so the more people get exposed to that technology, and just like we're talking about, all they got to do is get comfortable with it once, and then it'll be what they want the next time.
Yeah, I actually had a follow-up, just a routine appointment with one of my physicians this morning. We did it virtually. And I have to tell you, once I did it, I thought, gosh, this was so much easier than getting in the car, driving to the clinic, coming back. Now, my physicians here would probably get on to me if I didn't be very clear that telemedicine is a very good tool, but it shouldn't take the place of every visit. Sometimes you need those in-person visits with your physician, with your clinician. So there's a little bit of discernment that has to go into play about when a televisit works and when it doesn't.
Absolutely. For those of you who've just joined us, you're watching The Pulse, brought to you by the Helen Farabee Centers and the Wichita Falls Chamber of Commerce. My guest today is United Regional CEO Phyllis Cowling. Phyllis, what's the most challenging aspect for you in your role at the hospital?
Oh, wow. The most challenging. You mean recently or just in general?
Yeah.
Oh, sorry, I didn't hear that. So I'm going to take that as just kind of a general statement.
I mean, either one.
Either one? Okay. I think just the most challenging is when you think about an organization that has 2,100 employees, 350 physicians, and then about 150 or so volunteers. It's just getting all of those individuals, if you will, rowing in the same direction. And blessedly, we're able to do that. But from just kind of a, what do I worry about? Sometimes people say, well, what do you worry about, Phyllis? And I think what I worry about is, obviously any untoward event that may happen here. I think about cybersecurity, and given the fact that everything is technologically connected now, I worry about that. But the big thing that always is a challenge is thinking about what is it that I don't know that I should, and just trying to make sure that we're continuing to keep our organization moving forward for the good of the organization and for the good of the community.
You told me before the show that you have not watched The Tiger King.
That is correct. I have not watched The Tiger King.
Are you watching anything interesting these days?
Well, I don't know. It depends on your definition of interesting, I suspect. I figured out that I tend to watch shows. First of all, I think I told you that I'm not very good at watching things that are in a series because I always feel like eventually I may miss out on something, although obviously you can go back and catch up. But I tend to watch shows where people are doing things that I can't do. For example, I watch the Food Network. I'm not a cook, but I enjoy watching the Food Network. I don't do a lot of home improvement, but I could watch HGTV, 24 hours a day, I think. So my interest in watching things really, I think, is just watching other people do things really well that I'm not that particularly good at. One of the new shows that I'm watching, it's just on network television, is something called Songland, where they bring songwriters in who pitch their songs to singers. And what I enjoy about that is them watching the process of that song going from this raw, very, very basic structure to a real production and how it changes over the course of that process.
That's really cool. You guys probably have as much of a rigid new protocol since it started as any organization in town. What about handshakes? What about personal greetings? What rules do you have in place now for things like that?
I don't know that we have any. We've never really put any rules out on handshaking, although I think we've all just gravitated towards not doing it. Although yesterday I was visiting with someone and just at the conclusion of the meeting, stuck my hand out. He shook it, and I went, oh my gosh, I probably shouldn't have done that. So I'm still trying to unlearn some of those habits. But here, obviously, at United Regional, I think one of the things that we've had to get most used to is wearing cloth face coverings when we're out and about. Obviously, I'm in my office right now, so I don't have to have one on. But when we're in the hallway or when we're interacting with people, we need our face coverings on. And what we've learned is, boy, you get so used to seeing the smiles on people's faces that when that's gone, you miss it. But we've also learned you can see smiles in somebody's eyes too.
I want to read a note that Glenn Barham posted on our chat here with the video. Phyllis, a ton of thanks to you and your frontline staff for stepping up and performing way beyond what is expected. Wichita Falls and Wichita County has performed beyond expectations in this event. Our peer counties have not done nearly as well as we have. You and your staff have a right and should pat yourselves on the back. And I know you don't do that, but you guys in the health district and the people in charge of communicating to the public have done amazing work.
Well, thank you. And Glenn, thank you for those kind comments. And while I'm not going to take the credit for this, let me give credit. And that is, Glenn mentioned that frontline staff. And frontline, there's the front line, and then as I say, the frontest of the front line were our emergency department staff, our nursing units that were dedicated COVID units. These guys stepped up and they were willing to do whatever was necessary to take care of the community and to take care of their patients. And the great thing is that's what caregivers do, is to step up in those moments. And Henry, you may remember last year in April, when we went live on our Epic health record, we had this whole marketing slogan and campaign that said superheroes have sidekicks. That was epic. And man, did our team rise, elevate even more so their superhero status this year. But just again, I can't say enough great things about our team. And to your point, the team, the city, the county, health department, and quite frankly, the community. One of the reasons that we think that we've been very fortunate and not had this heavy load of COVID patients is because the community did what was needed, sheltered in place, took the direction very seriously, and that made a difference. So thank you to the entire Wichita Falls community.
What was your favorite subject in school?
Oh, wow. Well, if I go back to high school, I enjoyed both math and English quite a bit. So I was a little bit of a nerd. Well, I was a lot of a nerd. And then in college, what you may or may not know, a lot of people don't know, my background is accounting. So I took a lot of accounting classes and enjoyed them.
How'd you get into healthcare management?
Oh, wow. There's a story. When I came out of undergrad, I went to work for one of the very large auditing firms, accounting auditing firms, international type firm. And I was in the Dallas-Fort Worth office. And the way that you start in accounting as a staff accountant is you just get plugged onto different kinds of jobs. And I had manufacturing jobs, I had oil and gas, I had healthcare. And I kind of liked the healthcare. So when we did my annual evaluation, I talked to the partner. I'd like to do more healthcare. So over the next couple of years, I kind of got more into healthcare. I then went back and got my MBA. And coming out of getting my MBA, I talked again to a partner and said, I kind of like to get into healthcare. And he plugged me into an internal audit position for a hospital in suburban Dallas. And so I went and did that. Didn't want to be an internal auditor all my life, but within 5 months of starting that job, I was the interim CFO and then became CFO. And as they say, the rest is history.
And you've been at United Regional for how long?
That's a great question. I've got to think. 15 and a half years. And all told in healthcare, I have about 32 years of healthcare administration experience.
In that 15 and a half years since you've been at United Regional, what are you most proud of?
I'm proud of a lot of things, but if I had to sum it all up, I would just say I'm very proud of the culture that we built here. And I talked about the culture earlier, but what I so enjoy is we've got some 2,500 people who are dedicated to a culture of excellence here. When I came here, I don't think we were sure that we were capable of excellence. And so to see this organization rise to our capabilities, again, both for our own professional growth, but more importantly for the communities we serve, I'm just proud beyond words of what this team represents and the role we play for this community.
For most of us, this has been an entirely new situation. I realize in healthcare, whether you've been through this sort of thing or not, you at least are forced to think about it or to plan for it. When something like this comes up that you maybe haven't necessarily been through or not to this extent, who do you turn to for support or guidance or knowledge?
Well, the first thing I'll tell you is I've never been through anything like this. In fact, we had someone in the office a couple of weeks ago I was working with, and he asked me that question. He said, so Phyllis, in your career, how have you responded when you've experienced situations like this? And I said, I've never experienced a situation to this degree. I've been through natural disaster type episodes, but in terms of a worldwide pandemic that totally changes how you look at your healthcare organization and what your role is, I'd never experienced it. And so with regard to who do I turn to, first and foremost is my team. Again, we have a whole disaster preparedness team, an emergency management team. And there's another person to call out, Jackie Betts, directs those efforts for us. And oh my gosh, the preparation that had gone into play on the front end. So first and foremost, we rely on our internal experts. And then I was reaching out in a couple of instances to colleagues, other CEOs. I have to give a shout out to the Texas Hospital Association. It's done a great job of keeping us informed about the different regulations and changes and everything coming down. So it was a combination of internal and external resources.
What's your favorite spot on the hospital campus?
Oh, wow. Probably my favorite spot. Well, I'll give you two answers. Routinely, my favorite spot is probably the dining room, and not for the reason you may think. It's not because I love to eat, although I do. It's because that's the place I typically go where I can interact almost daily with members of our staff and have that opportunity to connect briefly. I'm not very good at doing formal rounds and interrupting people in their workplace throughout the organization. So just that moment of connectivity is very, very important to me. And then I do have to admit that a couple of weeks ago, my favorite spot was on the roof of the Bridwell Tower when we were treated to such an incredible honor by the Shepherd team with the flyover. And I was able to be on the roof with Colonel Bell and members from Shepherd as well as our team. It was pretty good viewpoint.
And by the way, we just learned that Colonel Bell is now Brigadier General Bell, the Commander Shepherd Air Force Base. All right, we're going to take a TV break here. So to all of our TV audience, thank you for watching this broadcast of The Pulse brought to you by the Helen Farabee Centers. For the live stream crowd on Facebook, stick around and we'll be back in just a minute. To everyone watching on Fox, you can visit the Chamber's Facebook page to watch this show in its entirety. Thanks again for Texoma's Fox 18 for airing The Pulse, and to Phyllis for joining us. We'll see you next week. And we're back. So yeah, that was great news about Colonel Bell. We knew that he had been nominated to take the rank of general, and I just heard this week that it came through.
Well, congrats to now General Bell. Again, wonderful addition to our extended Wichita Falls community. So proud for him.
So you're in healthcare, you're on the front lines, and your staff's on the front lines of this, and you guys get to hear a lot of things that the general public may not hear. What's your take on, will we get back to normal? What does that even look like? You know, what do our lives look like 6 months from now?
Well, for us, and I've been very hesitant to use the phrase back to normal. I know a lot of people have referenced new normal. The way I have tried to explain it with our team is we need to redefine normal. And I use that term because I don't want things to just happen to us. I want us to take some leadership role in that. So we're in the process of redefining normal. And for us, I've explained it to folks, as I said, it's almost like we have a foot in two canoes. One canoe is a continued state of COVID readiness. Because I do think that we're going to have waves of COVID potentially coming through at various times. I know some people are saying we may have a fairly high wave in the fall, and if that's coupled with flu season, that can be a little bit daunting. But likewise, we also have to redefine what do we look like in terms of our goals, our strategies, our ongoing operations to the service of the community. I will say we've learned a lot through COVID. Again, we talked about telehealth and telemedicine. How do we use that as something positive going forward? So 6 months from now, I'm hoping that we're not in the middle of another COVID wave, but we may be. And if so, we'll be ready. So I think there's going to continue to be change, and I think it's imperative on all of us that this negative experience not stay negative if we can help it. And the way we do that is learn from it and try to grow from it, which is easier said than done. I recognize if you're in a small business as an example, but it's still doable.
You like to travel. What is your absolute favorite place you've traveled to, and why?
Oh, wow. I get asked that, and the fact of the matter is I've loved everywhere I've been. And just by reference, this, but the audience doesn't. I have 3 friends that every fall we go somewhere internationally and have done that for, 10, 12 years. So I've been to some really cool places. But when I'm pressed to ask or to answer, my favorite place was South Africa. Not only because of just some of the history and some of the experience of that country, but as part of that particular tour that we were doing, we spent a couple of days in the national park there, which was basically we went on photo safari. And to put it in perspective, there was a point where we were watching a herd of elephants cross a dry river basin. We stopped counting at 100. And so that was an awesome experience.
That is so cool. One of my daughters is infatuated with elephants, and for about 3 years straight, she wore this elephant onesie to bed every night, and she's finally passed it down to our youngest. So that needs to be on her bucket list someday to go see elephants in nature. So you've got heavy responsibilities in your position. You've got a lot of people under you. What do you do to stay mentally and physically healthy?
Well, for the most part, what I try to do is in quote unquote normal times is just try to get some level of physical activity. I go work out a couple of times a week. I'm not one of those that does it every day, but a couple of times a week. I do miss getting to go to the gym, and so luckily that, as we know, has started back up. And I'll start next week once I get past a few meetings this week. So that's one thing I do. And I think the other thing is what a lot of folks do is just making sure that you have some folks, some very trusted individuals with whom you can share your feelings, your emotions, whether that's family members or friends. Just again, having those trusted, I guess, support network.
What do you say to somebody that's considering going into healthcare as a career?
Well, I think it depends on where in healthcare. First of all, anywhere, I'd probably say, yeah, do it. But I think there's a difference in folks that are like me, that are in healthcare administration. And then there's folks that are on, to your point, on the front lines, nurses, physicians, therapists, et cetera. And then a whole bunch of people in between. I think the thing I will say, regardless of where you work in healthcare, whether you're a direct caregiver or an indirect caregiver, I think the reason a lot of us go into healthcare is because we want to help people. And it is incredibly rewarding to be a part of a team that mean, literally saves lives on a daily basis. And while I certainly don't have that capability individually, I get to work with a team who does. And that's pretty cool. I think if you're anywhere in healthcare at this point, though, you have to be adaptable. You have to know that change is almost a daily occurrence in healthcare. Maybe not quite so much as we've had the last couple of months, but it's a constant. And so being flexible, being adaptable, I think is very key. But if you're looking for something that is a rewarding life, healthcare, you could do a lot worse than healthcare.
I've got a personal question from one of our team members. How can somebody see a loved one that's in the hospital who is nearing the end of their life?
If it's an end of, first of all, let me do a couple of clarifying points. At this point, we have not limited visitors completely. So our patients, unless they're a COVID patient, has the ability to have visitors at any point. But it is limited to one at a time, or optimally one per day. So in those situations where you have someone end of life and you're wanting family there, we make exceptions for at least some members of the family to come into an end of life situation. So if you're having that experience and you're concerned about that, please just talk with the nursing manager of that unit, or give our patient advocates a call, and we'll intercede and make sure that you have that opportunity at that point.
Got a couple of messages that I want to share with you. Vanessa Katz says, "Hi, Phyllis. Proud of you and your team. I miss being a part of the great culture at United Regional." And then Buena Ingram says, "My husband had a motorcycle wreck, a very bad one, a couple of years ago. Everyone, and I do mean everyone, from the helicopter ambulance to the emergency room people, to the ICU, to the regular room, everyone was wonderful. Thank you for what you have done."
Well, thank you, and hopefully all went well with your husband. But we so appreciate positive feedback like that. It's very encouraging and motivating to our team as well. Thank you.
What's one piece of advice you would give to the 18-year-old Phyllis?
Probably don't worry so much. Don't overthink everything. Let life happen a little bit. Be prepared to let life happen. I tend to be wanting to be in control of everything. And the thing I've learned over the many ensuing years since I was 18 is that you can't control everything. And sometimes life happens and you just have to go with it. So I think, that would be my advice, is just enjoy it.
So much of what we hear about, whether it's confirmations of cases or deaths, or even wearing masks and distancing ourselves from people, has become political, which is just nuts to me. But from a healthcare professional's look at things, what precautions should individuals be taking right now?
Well, I think first and foremost, and again, before I say that, let me be very clear. I'm not a medical professional. I am not a clinician by background, but I do, as they say on television, I don't play one on television, but I'm around a lot of them. And I think what most people will tell you, first and foremost, will be two things. Hand hygiene. Well, what is the old adage in real estate? Location, location, location. Well, for COVID and COVID prevention, it's wash your hands, wash your hands, wash your hands. Hand hygiene matters. The second is social distancing counts. Is just being aware of your surroundings and being aware of what you touch and who may have touched that before you. And so be very conscientious of that. I think one thing that I would like to clarify is with regard to masks or cloth face coverings, as we reference them. Those are really not designed, and I'm not talking about the medical mask or what we wear here. I'm talking about just regular cloth face coverings. They're not designed to protect you. they're actually designed to try to protect others from whatever aerosolization that may occur. That if you have a cold or a cough or COVID, that you're not transmitting that out into the wider universe. So here in the organization, we require our staff to wear cloth-based coverings whenever we're not in a private space. And we're asking our visitors and our patients to do it as well for that reason, to protect everybody. Out in the broader community, I don't know that it's necessarily a requirement, but I do think people should be aware of the need. But even if you wear a mask, it does not negate the need for social distancing and wash your hands, wash your hands, wash your hands.
How's morale on your team right now?
It's good. I think it's interesting because I actually think that some of our tougher times will be in front of us. Our team, nothing like a crisis rallies a healthcare team. I mean, people pull together, and I cannot overemphasize how well our team stepped up, from the frontest of the front lines to our leadership. Everybody just pulled together. And I think as we redefine normal, we'll see that we'll get back to some of our ways of, we have our turf battles and silos and everything like everybody else. But hopefully we'll learn from it. I'll tell you, our team has been very, very gratified by the community support. Again, we talked about Shepherd's Flyover. I mean, that was awesome, but also just the signs in front of our building telling our team thank you. I think a lot of times people can take healthcare for granted. We're here whenever you need us. But when you don't need us, maybe it's a little easier to forget about us. But during these last couple of months, I think our community and communities across our country have rallied around healthcare, and that does a pretty good thing for morale.
I got muted there for a second. What do you tell somebody if you're trying to convince somebody to come work for United Regional instead of a competitor somewhere else? What do you tell them?
Well, I'd say, first of all, as I mentioned, I mean, healthcare, it's just the ability to make a difference matters. And why United Regional versus somewhere else is because we live that every day. When we talk about culture, it's not just a word here. It's something that we take incredibly seriously. Now, I'm not saying it's perfect by any stretch, but we are very mindful and very deliberate about trying to create an excellent work environment and trying to deliver excellence in healthcare for the communities we serve. And that's a pretty cool team to be a part of.
So thinking about masks and other personal protective equipment, are there shortages right now? And if so, are there ways people can help?
Well, first of all, there are shortages, but not here, not at United Regional. Again, our team did an incredible job early on when we've been preparing for pandemic for years, but when our team, our materials managers, our supply purchasing group, when they first even heard about this inkling of what might be happening in China, they were making sure that they had supply chains open. So unlike a lot of hospitals and healthcare organizations, we were never in danger of running out of PPE, as long as we used it judiciously. Easy for me to say. So we were in much better shape than a lot of organizations. So we appreciated very much all the offers, and people came and gave us supplies, and we gladly took those with a lot of appreciation. And what we're continuing to do is we're building our stores for the next pandemic, or at least the next wave of this one as well. We're staying prepared.
What new advancements or upgrades or expansions are on the horizons for United Regional?
Oh, wow. As terms of physical expansions, we don't have any on the horizon right in the immediate future. But what we are doing is trying to continue to expand our technology. Again, last year we went live on our Epic electronic health record. That was a blessing as we came through the COVID, first wave of COVID. Our partnership with Epic proved very, very beneficial. They were rolling out a lot of COVID specific upgrades that we could take advantage of. But so technology will continue to be something that we advance both clinically and non-clinically, or in terms of information technology. Using our app called MyChart has also been very beneficial. So we want to continue to elevate that and roll that out. So a lot of what we will be advancing, people won't see quite probably not, at least not as clearly as, say, a Bridwell Tower that we built 10 years ago, or the expansion of the Barnett Road Medical Building last year.
Your team is probably the only other team in town that has the responsibility of selling Wichita Falls, selling people on Wichita Falls as much as we do. You've got your own physician and healthcare professional recruitment staff. What is their sales pitch to a doctor or some other medical professional trying to get them to move here? What is it about Wichita Falls that your team uses in that sales pitch?
There's a couple of things. First of all, we sell the health community, the medical community, and the fact that everybody here, again, pulls together, first of all. Second is, for a community our size of 125,000 people, catchment area maybe of 250,000 people plus, we have a very sophisticated healthcare system. We have technology, again, clinically and non-clinically. So that's a real draw to healthcare professionals. But beyond that, what we talk about is the community itself, and the fact that I would kind of characterize it as we're the right size of community, big enough to have things to do, but small enough you can still move around the community well. You can still get to know your neighbors. I specifically, when I talk with, in particular, physician recruits, I tell them, if you're looking for a North Dallas lifestyle, please don't come here, because that's not what we have. But if you want a community where you know people, you can engage with people, you're not spending all your time in traffic or trying to get to or from home, this is a great community. We get, I don't even know officially, 330 days of sunshine or something. There's a lot to love about this community for the right fit. We're not for everybody, but we're for a lot of people.
Large organization, one of the biggest in numbers of employees. You've got lots of customer counts. You've got lots of outcomes to measure. You've got lots of regulations to follow. How do you define success for United Regional?
Oh, that one's easy. It's providing excellence in healthcare for the communities we serve. It is excellence. Now, how you measure that, there are a lot of different ways to measure that. You mentioned some of them, but the definition is just core. It is ensuring that level of excellence for people who depend on us.
We're past the conversation about essential businesses. When this first started, that was all the talk was should your business be allowed to open because it's so essential to our community? We're past that now. Now the rules that the governor is putting into place are more focused on what businesses can safely allow people to go back to work and to frequent those businesses. What's your take on the way that process has gone, and what do you expect to see moving forward? Because everything's not open yet.
Yeah, and I think, I have to balance, because my priority is always in the physical health in my role, but I also very much am mindful of economic health, the fiscal health, if you will, and I think that is incredibly important. What concerns me, and you alluded to this earlier, what concerns me is that some of those decisions on who to reopen and who not to reopen at this juncture has been politicized. And that's what's concerning to me. I think what we need to do is we need to give people an opportunity to reopen, but with measures of safety. I personally want to see not only our community, but communities elsewhere reopen, but we have to do it safely as well. So it's getting that balance right.
Yeah, it's been a challenge because now, as they're just talking about what types of companies can safely let people go back to work. For example, a couple of weeks ago they said restaurants can reopen at 25% capacity, and a lot of restaurants, they can't survive doing that. And then you've got bars right down the street that serve food that say, okay, well, now you can go sit at a bar in a restaurant and order food and have a drink, but you can't do the same exact thing in a bar. It's a mess. And so I'm hoping they just can get to the point where they say, here are the guidelines to keep people safe. If you can follow these, you can be open, because it's a trust game now anyway.
Yeah, exactly. And I agree with you. I think we overthought it, or maybe we didn't. And when I say we, I'm really referencing maybe state and federal government, just trying to figure out who's essential, who's not. Again, it got so muddied down that I think we lost sight of why were we doing it in the first place. And again, trying to balance physical health and economic health. Economic health is absolutely critical to physical health long term. So being able to reopen the community is important. But you hit the nail on the head, and that is, but do it safely. And I agree with you. I think we've spent too much time trying to define essential or non-essential, or to your point, what's the difference between a restaurant and a bar, as opposed to what are the base measures that everyone needs to do to try to ensure or at least encourage health and safety.
Sure. And then you get a situation where these guidelines are forced down from the state level, and a lot of people feel like they don't make sense, and it doesn't even feel like the local communities, and I'm not just talking about Wichita Falls, that they even want to enforce the rules, because they know how difficult it is for a small business owner just trying to survive right now. What's your favorite movie?
Oh, wow. Favorite movie. Well, I do have to admit, and this probably again goes to my kind of nerd status, but all the Harry Potter movies were I love those, partly because I love the books. But I also go back in time and I think about some of the movies from the 40s and the 50s. I like the old black and white movies, different movies of different times. North by Northwest was a great movie, and various movies of that genre.
We've been binge watching some shows, but we've been just browsing a lot on Amazon Prime since this all started, and watching a lot of old shows like Columbo and the Rockford Files. One night I had turned on the first episode of the Beverly Hillbillies.
Oh, wow.
And our youngest, Callie, is 8, and she came in and laid down on the couch and watched it with me and didn't say a word. She left after it was over. And a couple of days later, she said, "Daddy, can we go watch that Gray show again?" And it took me a while to figure out what she was talking about, because I was trying to think of content. What was a Gray show? She was talking about black and white TV.
Right.
She had probably never ever seen that before.
You know what? You talk about those old television shows like that. I saw a clip from the I Love Lucy not too long ago, and of course it was the iconic, Lucy and Ethel on the candy assembly line, right? I still laugh out loud at that, and my great nieces laugh out loud at that. And you think that how old that show is and that clip is, and yet we still react to that. Those were classics, and they're classics for a reason.
No doubt. Same vein, we watched the first episode of the Carol Burnett Show a couple of weeks ago. Just crazy humor that you can't replicate, and people don't see that anymore. And the kids have watched that and the Dukes of Hazzard and all sorts of stuff. It's been pretty fun.
You talk about the Carol Burnett Show. For me, it was very funny, but that also evokes an emotion for me, because that was something that I watched with my mom. when I was probably in junior high, high school. And my mom's been gone now 13 years, but so that's an emotional connection for me, as well as just the humor of it.
What'd you want to be when you were little?
Oh, that was fun too. My very first career goal, I was a tomboy, and so my first career goal was to be the first female quarterback of the Dallas Cowboys. I soon figured out that wasn't going to happen, but that was the first career goal.
What do you love the most about Wichita Falls?
Well, probably is a little obvious, but I love United Regional, and I love the people here. But beyond United Regional, again, I like the size. I love the feel of this community. It's big enough, but not too big.
You've been here 15 and a half years. How do you feel you've grown as a leader since that time?
Oh, wow. In a word, immensely. I came here, I'd never been a CEO before. I'd been a CFO for 16 years or something like that. And so this was the opportunity, and that's what it was. It was, I wanted to see, could I be a CEO, and could I be effective as a CEO? And I look back now on my, you asked me earlier, what would I tell my 18-year-old self? Well, I would tell my first year CEO self, 15 plus years ago, some lessons as well. I had to learn how to be a leader. I had to learn, one thing I had to learn is that when I was thinking out loud, hey, we might want to try this, or have we thought about this? I learned that people took that as, oh, we need to go do it. And so I had to clarify, as an example, when I was simply thinking out loud versus when I really wanted us to go do something. I think I'm still learning as a leader, and I hope that I continue to, because I really feel if you're not learning, if you're not growing, you're dying. So I continue to look for opportunities to improve and change.
What would you tell somebody that was in your same situation, first CEO position at a hospital? What do you tell them?
The very first thing I would say is pick your team. Figure out who you need on your team. And what we did here, in fact, I remember interviewing here. Remember, I was interviewing. I had not been a CEO, and I was interviewing with a search group, a search committee. And truthfully, I was interviewing with the search committee for experience. My goal was don't embarrass myself or don't embarrass the consultant, the search consultant. And lo and behold, it materialized an actual role. But what I told the search committee is, I said, if you're looking for someone, I recognize that I've got no experience. And if I were in your shoes, I'd be questioning, should we hire somebody with no experience? And I said, if it were only about me, I wouldn't hire me either. But if you want somebody who can put together a team of complementary skills and strengths that can collectively lead, I can do that. And so I think that's to me was the first most important thing, was start to figure out who needs to be on the team. I partnered, I think our Chief Operating Officer, Nancy Townley. She has a clinical background that complemented my accounting or finance background. And so I didn't want to replicate someone like me in that role. I needed someone different. And as a result, here we are almost 16 years later.
We've got about 1 minute left. And I know you communicate with your team a lot, but here's a chance to do it in front of a bigger audience. If you had something to tell your team right now, what would it be?
I tell them the same thing that I said to them a week ago on a megaphone in the street, and that is, I am so very proud of them. I am so incredibly proud of what the United Regional team has done, not only over the last 2 months, but over many, many, many years. And there is nowhere I'd rather be right now than with this team, crisis or no crisis. So thank you to these superheroes here at United Regional.
All right, well, that's it for today's edition of The Pulse. Thanks to Phyllis Cowling and our sponsor, Helen Fairview Centers. This show can be found in its entirety on the Chamber's Facebook page at texomashomepage.com and on KJTL Texoma's Fox 18 each Sunday. Speaking of Helen Farabee, join me next Wednesday with my guest, Roddy Atkins, Executive Director of the Helen Farabee Centers, as we talk about mental health issues related to COVID-19. I'll see you then.